and many more have joined on YouTube. Welcome to all of you for this webinar series on women's mental health. It will be from today to 12th of January, that's Friday. Today, the first talk in this series will be delivered by Professor Geetha Desai, Madam. We will be speaking on gender and mental health. Madam is a professor of psychiatry at the very prestigious National Institute of Mental Health and Neurosciences. Madam has done her MD, DNB, then PhD, then PGD, MLE. Our areas of specialization include perinatal psychiatry, women's mental health, chronic pain, illness behavior, somatoform disorders, etc. And Madam has published more than 100 research papers in journals of national and international repute. On behalf of me and all the attendees who have joined on Cisco WebEx and YouTube, I welcome Madam to deliver the talk. And I take this opportunity to thank my friend Dr. Bharat Srinivas. In fact, he has been very helpful for me to organize webinars related to mental health. Earlier, we have organized many talks by immense experts. Again, he has helped me in putting together this webinar for 5 days. I'm sure attendees will be highly benefited by talks by experts. Dr. Geetha Madam has been very kind enough. As I wrote a request to Madam, immediately she agreed to deliver the talk. I'm thankful to you, Madam, and again welcome to you to deliver the talk. Now over to you, Madam, for your talk.
Yeah, thank you very much for the kind introduction, and I think it gives me a great pleasure to be part of this wonderful initiative that you have all taken to kind of utilize the platform to have wide variety of topics that from what discussion I've had with Dr. Srinivas Bharat, and I thank you. What I'll do now is I'll share the slides. Yeah.
Yes, Madam.
Yeah, here I go. Can you see the slides, please?
No, ma'am, not yet, ma'am.
Not yet?
Not
Now?
yet.
Okay.
Madam.
You can see now?
Ma'am, I think you need to share it once again.
Okay. Okay. All right. Is it better now? Okay, I'll again share it. Applications, Windows, yeah, and mental health, share.
Yes, ma'am. No,
Can I? Yeah. Done?
Yes, ma'am.
Okay. Good afternoon, everyone, and thanks for joining this discussion on a very important topic, gender and mental health. The reason why it is important is that, day in and day out, we discuss so much about men and women, about health and well-being. So, this series of, I would like to begin this series of lectures by first discussing why it is important to discuss about gender and mental health. So, the outline of this presentation is about what actually is gender, what is mental health, what makes women. I mean, since the lecture series are going to be on mental health of women across lifespan. So I'm just going to raise some questions in how different men and women are, and what are the common mental health problems that affect women, and why do we think that women are more prone to these mental health problems. Now, if we understand, I mean, there's a lot of discussion on gender equality, gender equity. Uh, Men and women, are they same in the physical, apart from the physical differences? Physiologically, are they different? So, evolutionarily, if you understand that there are specific things which are different for women and men, that could be also to do with the functioning. Like, for example, women are of small build and men are of big build, and men did specific things, and women have reproductive roles which are very different from men. So I think that evolutionary, and then, certain changes started happening. Now there are evolutionary things which are different among men and women, and at the same time there are also differences in terms of the roles, the psychology, the functioning. When there are differences, can there be equality? Is the second question. Of course, if there should be equality, how do we discuss these equality when there are differences? I think that is where this issue about gender comes in. Now, gender refers to the characteristics of women, men, girls, and boys. It's more of a social construction, whereas the term biological sex that we talk about refers to the physiological characteristics of females and males. Now that includes your chromosomes, hormonal changes, and other things. So that, whereas gender is more about a social context like norms, and what should women be doing, what are the roles for women, what are the behaviors that are prototypical for women, man, or others. So this is the concept of gender. So we are not really going to talk about the biological sex, but rather the social construction. Now, why is it that we are talking more about social construct? Is because that's a very important element that determines how mental illnesses vary across men and women. Now, what is mental health? Yeah, I am sure, post the pandemic, lot of emphasis has been given to mental health, more so among students. So basically, mental health, the World Health Organization defines it a state of well-being in which the individual realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her community. Now, if you take all this definite, I know it looks a little complex, but basically it means that, does that mean that we are all men, we don't have an illness, or does it mean that we are all well? Basically, it says that each individual should be able to kind of handle the stresses of day to day life, and should be able to work productively. When we say work productively, that does not mean the salaried job or anything. It just means that to carry out the daily activities, and is able to. So there is a social domain, there is a domain related to occupation, I mean functioning, and there is also a satisfaction, a sense of satisfaction in our own values. Now, when we talk about, I mean, we all know the definition of health. It's physical, mental, social. Many domains are there for health. So, mental health, I think it's probably not a very commonly used definition, even though we know what mental health is. But I think this probably sums it up. And we should also understand good mental health is not about absence of mental illness. I think it's more to do with the fact that mental well being. When we say well being, all these terms that I discussed in terms of individual, in you're aware of your own abilities, you're able to manage day to day stresses, you're able to also work and contribute to your community. So, this is in a broad sense. So, just because I'm not depressed does not make me mentally fit or mentally well. Okay, so that I just wanted to highlight. Now, that is where it's very important for us to understand mental health is a spectrum. Somewhere you might not have depression, but you still can be stressed, you can be distressed about the events that are happening. Now, we all know that life throws so many challenges at us every day. We faced COVID, which was a situation which we did not anticipate. There was lockdown. These are abnormal stressors. That means it's not something that you can cope on your own. You need to adapt to extremely difficult and different situations, but we still managed, isn't it? There were lots of challenges. So sometimes I think it's very important to understand that there will be challenges. We all might are likely to feel emotionally drained. We will be facing day to day challenges, not able to sleep, and especially, let's say, if there I'm not sure if students are listening, and exam, then you that's a stress, right? But you are able to kind of cope with it, you don't avoid it. But the same exam stress can also lead to an abnormal responses, like you're so stressed that you can't eat, you can't sleep, you can't even think of going to the exam, you avoid writing exam. So that's an extreme level of response. And so I mean, we can respond to things in a different way. Like, for example, like I said, if there was a lockdown, I could be responding in a way that I can sit and cry and not say that, okay, I'm not going to do anything, or start avoiding even phone conversations and things like that. But, or I can say, yes, this is the situation that wants is, what is it that I can do to adapt myself to this situation? So there are different ways of how we deal with stresses of life. Now, how does gender affect our well-being? So we have, gender affects different aspects of life. Like, for example, the way I respond to when I become unwell might be different from a male member who has the similar illness. It can, one, how do we understand our health? How do we understand ourselves? How do we interact with one another, our relationships, the way we cope with others? There are significant differences in the way men and women cope with stress, the way they respond to each other, relationships. Now, this is not a watertight compartment. Men will behave like this all the time, and women will behave in a particular way all the time. So there are other factors that will also determine. One is about the age factor. The other is about how long the stresses have been going on, different kinds of stresses, support system. So these are possible differences that are likely to be there in when you consider gender. Now, what are the differences in the way gender plays a role? Like, for example, I've just expressed one example. Like, we know that men are likely to express their hostility through physical violence. Anger is much more, aggression is much more evident in men, whereas women are more likely to be verbally expressive and more of they kind of have these negative emotions which they express: happiness, sadness, or fear. Now, men also can express sadness as violence or hostility, anger. So there is some ways, but this is, like I said, this is one example of it, but it need not be present in everyone. Now, how do men and women cope with stress? So, like, for example, there are two. I'll tell you, how do we cope with stress? One, emotional coping, we say that we feel sad about it, we start worrying, thinking, crying about it. There's another way, problem solving. So where you take an active role and say, no, this is how I want to deal with these situations. And this is basically taking care of the stress. Now, there are advantages and disadvantages. Now, I'm not saying that emotional coping is bad and problem solving, because women tend to use more emotional coping, and problem solving is by men. However, each one, like, for example, I'm just giving you an example to make you understand how it can be different. Like, for example, let's say somebody has been diagnosed with a terminal illness. Now, emotional coping is going through the anxiety and sadness and discussing about it, expressing your emotions to some extent will be helpful. But just straight away, let's say I shut my emotions, and then, okay, what is it that I need to do about this situation? I need to go and get these scans and other things. That also can sometimes, avoiding your emotions or completely getting so engulfed by emotions that you can't take action is also problematic. So I think there should be a good balance, but these are the variations that one sees in the women. And women probably also seek more social support. They can express their worries and fears, and that's how they deal with stresses. um, Now I've just kind of mentioned what are there are lots of debates about whether men are intelligent in certain aspects. I'm not going into any of this because I think these are more in terms of I don't think that's what we are looking at. There are some data which is saying that men might be good at particular aspect domains of intelligence and women. So intelligence is a very broader concept, so I'm not getting into that. So we know that, like I was talking to you about evolutionary concepts where men and women are very different. So how has this affected women and mental illnesses, right? Now, I'll just take you through the life trajectories or at what all levels women could have difficulties in mental health. Like, for example, before adolescence, the prevalence of depression and other conditions is almost the same. But in adolescence, that is, during the pubertal age, there are high prevalence of depression, eating disorders, and suicidal attempts and ideation. Even women in adulthood, again, depression and anxiety is 2 to 3 times higher than what is seen in men. And there are also a lot of other illnesses which are more common, like eating disorders, PTSD, self harm attempts. And in old age, again, depression is quite common. So the bottom line is somehow the depression and anxiety seem to be quite high among women when compared to men. Men, like for example, let's say ADHD, attention deficit hyperactivity disorder, is much more commonly diagnosed in men than in women. Alcohol use, substance use disorders are much more common in men than women. And there are other severe mental illness where the differences are, the prevalence differences are not very high. So women tend to experience depression and anxiety much more common, more so related to the reproductive life events like puberty, and after that it is about during pregnancy and postpartum period and menopause. So these are the times when actually there are changes in the mental health problems of women. Now, coming to the common mental disorders in women, these are, like I mentioned, depression, anxiety, or so if they are very common in women, then we also need to understand that women are more likely to seek help. Whether they get help or not, that's a different matter, but there are more chances of women taking help for depression and anxiety, which it varies again across the countries. But there is very significant connection with the reproductive life events. I'm not going to talk about postpartum depression or premenstrual syndrome and premenstrual dysphoric disorders because these topic and menopausal related depression, because these topics are anyway going to be covered by in the other series. Now we know that the reproductive hormones have a very important role in the changes that I mentioned regarding differences in men and women. So the same thing is applicable even in postpartum depression as well as menopausal depression. So the reproductive hormone changes have a big role in how illnesses manifest in women. Now, so can we explain the differences only based on these, reproductive hormones? No. We need to understand that women also get exposed to girls, young girls, and women. If you look at the adverse life circumstances, abuse, these are more likely to occur in girls and young women at all levels, and domestic violence also is much more common among experienced by commonly by women. So again, like I said, there is biological differences, then comes the exposure to these events, which also puts women at risk for developing anxiety and depression. So that is where it's very important for us to understand mental health is not because of just the biological differences, but also in terms of how the social issues can also determine how mental health. um, like for example, studies that have looked at adverse childhood neglect, or opportunities given for a girl child and a boy child might be very different. So gender disadvantages is a big risk factor for developing mental health issues at different points of time. That is why it is very important for us to understand that there are many factors that influence mental health among women. And even though these are common mental disorders, but they're still associated with significant disability. Like for example, severe mental disorders, where I'm not sure how aware of what schizophrenia and bipolar. There are differences, not in terms of prevalence, but how the illnesses they respond, women respond to treatment, what happens to women over a period of time. So there are differences, but not in terms of whether women have more schizophrenia or men have more schizophrenia, but it's more to do with what happens to them once they develop the illness. Now, like I was mentioning, there are differences between men and women in mental health, like evolutionary differences that I talked about. Other thing, hormonal factors, gender disadvantages, that I will just tell you about what are the things that we can do to make these handle these issues. Violence, exposure of women to violence, and multi role. I think the other two do not have very significant evidence, but I also think that multiplicity of roles women play in the society. Like for example, most women are caregivers. They're caregiving, but to either patients or their family members, or who are going through physical illness or mental illness, is women. So I think that they play the role of wife. If they're earning, then there is an added burden financially, and poor support. I think even though we say that women are more likely to seek support, but not having that, and like for example, if a woman is facing violence by the family member, and most often it is the family members who are involved in the domestic violence, so there's not enough support to go seek a respite, because they may not be financially independent, or there are restrictions from the society that you are not supposed to be away from your family of procreation. So all these factors puts the woman at risk for mental health problems. Now, we also need to understand that like I was talking to you about gender disadvantage. Let's say if there is, as a child, the girl has already faced differences in terms of the way boys are being treated, and the girl is being told that okay, you have to tolerate these things. When she's subjected to violence, she might resort to things like it becomes unbearable. They might develop depression, anxiety, and unfortunately it can end up in suicide. And there are also a lot of other aspects to women in mental health. One big change that happens is post when they have children, so the caregiving becomes predominantly women's role. So I think these are some of the areas that where are likely to kind of increase the risk of women to develop mental health problems. Now, what is it that we can do to improve mental health well-being among women? See, some of the changes are biological, hormonal factors. Yes, the hormonal factors interact with ongoing psychosocial stresses, and therefore, what is it that we can do to address some of these issues? Like, for example, gender disadvantage. There's a very nice gender equity continuum. If you look at how we can as a society can have these interventions, like for example gender transformative interventions, so where we acknowledge that there are inequalities, and we need to work towards transforming these gender roles, norms, and power relationships. The reason why I put this slide is, I think mental health, yes, it's is not just about biological things. There are many other social things that will contribute to mental health of women. So that's the reason why I wanted to bring this. I mean, all of you can just kind of see where do we stand in. In our society stands in, but I also understand that things have changed quite a bit in the last decade. So I see that many women are getting education. They are taking up financial respons they're financially independent. But there is a class ceiling. After that, leadership role, somehow you see that there are areas where men predominate and women are hardly seen. So I think we are going somewhere. We are in a progressive situation, but at the same time, there are still, but it's not uniform. There are ups and downs. There are some places are going ahead, some places are not so. There are excellent programs to prevent violence against women, but how much does it actually translate it to reality is the second question. Because I know that there are a lot of services, but why is it that important for us to know these things is, if it is going to affect women's well-being, mental well-being. So I think it's very important. And I think, I hope there are more men listening to what I'm saying, because I'll tell you why I want to emphasize this. I think we focus a lot on women well-being, and as of course violence perpetrated most commonly by men. But I think it's important for us men to be part of these discussions, so that we all work together to create a better and safer society. So I think that's the reason why I feel that gender issues are very important. Not, I mean, I'm totally talking about mental health, but also overall, development. I also wanted to, I'll just give you an example of how mental health. I know that now with the social media, again, how has it affected social media use affected women and men differently. So there's a lot of concepts. Some of these concepts are very important. I've not put them on slide. The reason being, I think one is about body shaming and need for approval. These are some of the things. Safety is another thing. Of course, there's going to be social media. So how does it affect women and men differently is something that we need to look at. Not that women are using it less or men are using it more. It's just that how is it going to, because we are seeing that women tend to get affected by it much more, about more related to the appearance. And there's a lot of expectations that I including young mothers. I see that young mothers losing weight or something they put up, and then that's added pressure to women who see these posts. So across lifespan, I think women have different challenges that puts them at risk for developing mental health. What I think we need to look back and see what is it that we can do to prevent certain things so that they don't develop mental health problems. So I think I've taken about half an hour. If anybody would like to ask a question, and then I can continue.
If you have any questions, I request participants to post it in the Q&A section or in the chat box, or they can raise their virtual hand so that we'll unmute and you can continue. Please continue, ma'am. If there will be any questions, meanwhile, I will ask them.
Okay. So, what is it that we can do? I think developing an awareness about mental health problems. I gave you a definition of mental health. So, I think just sometimes it's important to know these things just to kind of, be reflective and see where am I now. And the second thing is also about reaching out to people. And when you're going through you know a low phase, I mean, I'm not talking about what is depression and what is anxiety, because okay, there's a question, sorry, I it just how to boost the morale of a child caretaking mother, uh, taken break from the career and staying at home. I think this is a very good question. I'll tell you why, because this is not about the mother. I'll tell you why we are all responsible for the situation, because in our mind, I think we've kind of, I know that many women are being praised for super women and, they are like multitaskers, and somewhere they are earning so much and they are doing different things, they're financially independent, at the same time they're also looking after the family. So let's first, as a society, I think we should respect the woman's decision. If she has taken break from the career and looking after the children, that is also good. But if a woman wants decides to work, and the children are taken care by the spouse or the family, that's also good. So why is it that I think sometimes it's comparison that actually kind of makes them feel very their morale comes down, because everybody kind of puts them up on the pedestal and say, oh, they're doing everything together. So I think that's why I brought this Instagram and social media things, that please normalize a mother taking break from work and looking after children. Second thing is, these are all policies. How do we, let's say this mother wants to come back and join work after, maybe 10 years. What are her options? There are hardly any options, right? So I think it's very important for us to create those options. And now there are a lot of changes in the family as well. Most of them are nuclear families, and also, very poor support systems. So some things that are already in place are, providing childcare facilities, if the mother wants to work at, and providing a little more flexibility at workplace, working hours flexibility. I think these are some of the things that, sure. But like I said, the decisions of moms we need to respect, and these comparisons need to stop. There's no reason why we should be comparing one to another. Each person has their own decision, and most often it is the others who make them feel that this is the wrong decision, and that's how they end up feeling very dejected and depressed. Yeah. Any other questions? I cannot see the YouTube if they have any questions, if they're put there.
Yeah, I am checking, ma'am. There are no questions as of now. I requested
Okay.
there.
Okay. I hope I have answered your question, Mr. Vijay. The other things that we need to talk about is, I showed the gender transformative interventions. That should begin very early. I think, even as I know that, like I said, there are lots of changes that are very good, but what can we do to improve, the situation? Like, for example, I would say, like adolescents, being creating safe spaces for adolescents to discuss their health related problems. A lot of times, there's bullying related to the body image, body shape, body shaming. All that happens within the institutions and other things. So I think it's very important that we address these issues, and all colleges everywhere it should be very kind of discussed openly. The second thing is, how do we teach resilience? I know that, I mean, I'm not sure if you're all aware of life skills education. How do we teach resilience? I think it's very, very important that we teach children and young adults to be resilient, because we know that situations can be very, very difficult. So, one of the strategies is also to you know I am sure there are a number of experts who talk about parenting. Is also one of the important part is about making children, young women, resilient to deal with the stresses. Making, sometimes information is a very good power that women can have about what is okay and what is not okay. Also, at workplaces, there are, I would say, gender sensitive approaches at workplaces, including in hospitals. How are women treated? How are men treated? So, gender sensitive workplaces is also where some of the things that we can do. So my presentation today was just to give you an overview of how men and women differ. There are books written on gender and mental health, but I thought I'll just stick to the simple things, that how men and women are different in some of the approaches, but that doesn't make them but equal opportunities need to be given to both, so that we prevent any further gender disadvantages, which can be a risk factor for developing mental health problems. I will stop here because I think it's already 45 minutes. So if there is anything that you would like to ask, please go ahead.
Madam, thank you very much for a very insightful and informative talk on gender and mental health. I'm sure many attendees who have attended will be highly benefited by your talk. Couple of questions are there. Are there specific mental health challenges that disproportionately affect individuals based on gender?
Like I mentioned, depression and anxiety are much more common in women than men.
And second thing is stigma related to mental health, especially in case of women, is more so. How to reduce this stigma? Is it only through awareness and talk like this? Are there any other strategies that we can adapt to reduce this stigma?
I think that's a very important question, because many are aware that they are going through difficult time or facing mental health challenges, but they cannot reach out. One is about normalizing some of these counseling sessions. Somebody who seeks counseling, there's no harm in that. But somehow I think, yeah, like I said, it may not be actually I have also seen most of it is sometimes assumed by the person who are going through it, that there might be something, what if others come to know? How will I be discriminated? Will I be treated badly? Will I be discriminated? So I think there's a long way. A lot of people are openly talking about nowadays about depression and anxiety that they go through, but lots needs to be done. Also, I think more, I would say, from societal aspects, how it's okay to be not okay, and how it's okay to go to a psychiatrist or a psychologist to seek help. For women, it's a little more difficult because I mean, most often young women, then the families will say, you're getting married, you're going to get married, who will marry you if you've gone to the mental hospital? So some of the concerns are very real. I will not say that these are very real, and then people don't understand what depression is, what schizophrenia is. So there is a big question there. I think women will face that, and once they get married, if they develop a mental illness, they're more likely to be abandoned. We also know that now we know that there are good treatments available for mental illness. I think we should also talk about that, there are treatments available, and you are likely to get better and then move on with your life.
Thanks, madam. Dr. Bharat Srinivas has joined. Sir, Bharat sir, thanks for joining. Now, over to you for your words, Bharat sir. He may be in the meeting.
Oh, okay.
Madam, thank you very much. In fact, we have to organize more such talks to bring awareness about mental health. Could be, mental disorder could be treated. Treatments are available. This is like any other disease that we get treated. So there should not be stigma associated with that, and people should straight away go to a psychiatrist and take help. Such I'm sure in the coming days, uh, such things will happen freely rather than in secret. So on behalf of KSTA and all the attendees, I'm very, very thankful to you. In spite of your very busy schedule, you could make it convenient to deliver this talk. We'll be uploading this talk on our YouTube channel also. Many have joined on YouTube, and many who could not join will be able to listen to your talk and be aware of all these mental health issues that could be solved easily. Thank you very much, ma'am.
Okay, thank you. Can I log out?
Just one more question is there, madam.
Okay, what are the top 3 things?
Top.
Yeah, I mean, it's a very non-specific question, but I'll tell you what we can uplift. I'm going to take a little more time to explain. If
There is
uplift
time.
women's mood is a very broader thing. I mean, I'm not sure, is it being depression, anxiety, what is it? What I would suggest is, like, for example, how we exercise to keep our physical health well and take care of our nutrition, and we ensure we do read to stimulate our cognitive functioning, like that. What is it that we can do to take care of our emotions? I'm going to talk about what we can do to take care of our emotions. One, I think, just have improving our literacy about what, being aware of what am I feeling now, labeling these emotions. I think that's one thing that is very important. Thing is about, there are various other, like, for example, keeping a journal of your negative thoughts that you worried about. Like, writing down your worries is one way of reducing your worry. Second thing is, if you're feeling sad and if you think that you're not able to figure out where this is coming from, do simple things. Even physical exercise is known to improve mood. Physical exercise, like simple exercise, meditation techniques are there which can improve mood. And sometimes it's about self care. I think that's another thing that can improve mood. But like I said, it could be related to premenstrual phase, or whether it is any other circumstances. Sometimes a woman might be going through this. A patient listening from someone close to her is also very, very important. Rather than pushing the person to feel happy all the time, just a patient listening is something that is required to be done. Like I said, exercise, being aware of your thoughts, a little bit of mindfulness practices also help in improving our well-being. That means mindfulness, I know all of you can google it and find out what it's, being in the present rather than worrying about what happens in future and what has gone on in the past. So I think these are some of the things that you can do to improve your mental well-being. While I'm saying this, and also having a little bit of work life balance, providing time for relationships, I think these are some of the things that can be done.
Thank you very much, ma'am.
Yeah.
There are no other questions, sir. Thank you, sir. You are muted, sir. Ramesh, sir.
Okay, madam. Thank you very much again
Yeah.
for explaining about uplift women's mood. Yes, I'm sure Vijay has good information. Take home message from this talk, and in fact, everybody will be happy to listen to this talk and uplift their moods. Okay, thanks, madam.
Okay. Okay. All right.